dizziness and balance problems are fantastically common. You can't see them, but they are out there. In fact, 30% of us, 3 out of 10 of us, will see our GP before the age of 65 with dizziness. It's astonishing, isn't it? And over the age of 75, the commonest reason to see a GP is dizziness. And if we break down different types of dizziness, some that you may have heard of, BPPV, which is little crystals in the inner ear, which is terribly common, occurs in about 1 or 2 in 100 people, especially when you get older. So if you get dizzy when you lie down in bed and roll over, almost certainly BPPV, really easy to treat. And then we go through less common conditions like Meniere's disease, which many people with dizziness have read about. And that occurs in about 1 in 2,000 people. But strangely, migraine we recognise now as a very, very common form of dizziness. So 4 out of 10 people who see me in the clinic here may have a balance problem, but they have migraine as well. So migraine contributes to their balance problem. And between 5 and 15% of men and women respectively have migraine in the community. And 1 in 10 migraine attacks are vertigo, are dizziness. So you don't have to have a headache to have a migraine. And these attacks then, if you do the numbers, 10% to 10%, it's a big number, isn't it? Still 1 in 100 people get migraine-associated vertigo. So it's incredibly common, and actually a lot of it not that well recognised. Vertigo is a description of a symptom. It's really important. It's not a diagnosis. Many people will come and see me and say, my doctor has diagnosed vertigo. It doesn't mean anything. It's like saying my doctor's diagnosed tummy pain. It's a symptom, it's an experience. It's an hallucination of movement. It's the sensation of either the world moving around you when it's not, or you moving around the world when you're not. That's what vertigo is, a false sensation of movement. But it's only a symptom, and it is caused by an underlying disorder, which might be in your ear, very commonly, might be in your brain, or might have other causes. There's lots of different terms you'll hear. So lots of people come to us with labyrinthitis, and very, very few of them have labyrinthitis. If we look at this model over here, this is the ear on the outside, and we go down your ear where you're not allowed to put cotton buds, down to your eardrum, through your middle ear where children get glue ear, and then deep inside your skull. And deep inside the skull here is the labyrinth. Now the labyrinth has got 2 parts. This is the cochlea, your hearing organ, and this is the vestibular labyrinth, the balance organ. So by definition, if you have labyrinthitis, you have an inflammation of the hearing and balance organ, often caused by a virus, for example. The thing is, to have labyrinthitis, not only do you have to be very, very dizzy and sick with vertigo, but you also have to lose your hearing. So the great majority of people with labyrinthitis do not have labyrinthitis. What they have is a condition called vestibular neuritis. So if we go even deeper into the skull, behind the labyrinth, you have a nerve. This is the vestibular nerve, the balance nerve, which runs into the brain. And if you get a virus activated on here, the nerve swells up and it damages the balance organ, and that causes acute vertigo. So this is one of the commonest causes of acute vertigo, and patients will wake up or develop severe dizziness, often with nausea, vomiting, and maybe bedbound for a day, 2 days, several days, a week even with this. And then when the spinning stops, they feel very unsteady and drunk. And then over a period of days or weeks, will generally get better. And those who don't get better come to the clinic here to try and get their balance improved. And what causes it is interesting. We think it's a virus, usually. There are other causes of it. And one of the common viruses is the Herpes simplex virus. And that's the virus that causes fever blisters or cold sores. And it's often been there since childhood, since Aunt Minnie kissed you when you were 2 years old. The little virus goes in through your skin, and then it rests in the nerve ganglion here. And then much, much later in life, perhaps when you're stressed or unwell, the virus reactivates, makes the nerve swell up, and then you get vestibular neuritis, an acute onset of dizziness. And if you don't get better, we have ways of rebalancing the balance organ, and that's a lot of the therapy that we do here. But it does really interesting other things. The nerve swells up in the solid bone of the inner ear, and as it does so, the nerve is running through a narrow channel and it affects the blood supply. So it then damages the inner ear in a different way, and sometimes the little crystals that line the inner ear break off. And then our patients who are presented initially with severe persistent dizziness, which gets better, months later get short spins when they lie down in bed and roll over. And that condition is BPPV, benign paroxysmal positional vertigo. It's incredibly common. About 1 in 100 people will experience it. When your labyrinthitis or vestibular neuritis or whatever has damaged your inner ear has passed, the function of that inner ear may be lower on one side than on the other side. And the brain misinterprets that. It doesn't understand the signals coming to it. And that is a vestibulopathy. Opathy means damage to, and vestibule, you've seen, is the part of the balance organ. So vestibulopathy is damage to the inner ear balance organ. And a good analogy of that is to consider yourself a propeller plane. And each propeller is your inner ear balance organ. And you have a bird strike on one of your propellers. And you start to spin out of control. And you can do 3 things. You can do nothing, and you'll crash and burn. And that's a bit like taking to your bed, because you'll never get better if you take to your bed and stay in bed with these conditions. Or you can wrestle with the controls to get the rudder and the flaps and elevators on your plane corrected. And that's a bit like the physiotherapy program that we'll put our patients through. So the brain learns that each ear is functioning in a different way, but it can adapt to it. Now, you can take the analogy further. So in a storm, the plane's still not quite as stable. So if you're unwell, maybe your balance condition gets worse. And we find that in patients with vestibulopathy. And then the third thing you can do is turn off both engines. If you turn off both engines, you'll start to glide and the juddering will stop, but you'll never fix the problem. And eventually, you'll crash. That's the same as taking medicine that turns off your balance. And many, if not most of our patients coming to see us here will have been on a medicine called prochlorperazine or Stemetil to start with. And that's great in the short term, but it stops you getting better. Now, several things can happen when you get vestibulopathy, when you damage your inner ear. You may just correct yourself, and that's what most people do. But sometimes the brain takes a shortcut, and it uses your eyes to overcome the damage to the injured inner ear. And we call that visual preference. So you're using your vision, your eyes, in preference to your ears. In America, they often call it supermarket vertigo, because patients find it very difficult in complex visual environments, in crowds, in supermarkets, in John Lewis escalators. Terrible for our patients often with these type of balance conditions. And in fact, if you want to do that yourself, you can show it yourself. So if you just have a look at your thumb and wiggle it as fast as you can, side to side in front of you, your thumb is going to look a blur. And doing this, you're relying on your vision to try and stabilize the image. But if you now turn your head as quickly as you can side to side, that image is absolutely stable. And the reason is the fluid in my inner ear, balance organ, is moving and moving my eyes side to side. So the ears are very powerful stabilizers of balance. And if you don't use them, or they're injured, your balance will be poor. That is vestibulopathy. Although most people get better quickly, in days, from a vestibular neuritis, perhaps a little bit longer from a labyrinthitis, very large numbers of patients don't. At the Leicester Royal Infirmary in our balance clinic, we run one of the biggest balance clinics in the UK, and we have 7,000 appointments a year there. And it's so busy, we can't see patients from outside the county. We're utterly overwhelmed, and the waiting times have got longer and longer. And we're barely scratching the surface, even with that number of appointments. And it's needed because of what is often devastating impact on patients' lives. Many people lose their jobs. Many people become very, very depressed, as you would with a chronic illness. And the problem is that lots of different issues come to arise together. So to start with, we have an injury to the inner ear, which causes vestibulopathy, so our patients feel unsteady and sick. they're nervous going walking, then maybe they develop visual preference, they become eye dependent. So going to the supermarket, being a passenger in a car, is just horrendous. So people become more housebound. If you become housebound, you decondition. Your muscles get weaker, your fitness gets worse, your balance organ rusts up, your mood lowers. So anxiety and depression, which are very common in all chronic illnesses, become very important. And then you combine that with the fact that 40% of patients with chronic balance disorder also have migraine, which makes all these symptoms much worse, and you've got a really, really horrid situation. So people then need to de-stress their lives. So my patients will start working part-time or often have significant amounts of time off work. And for many people, this is devastating. Many of our professionals, doctors, lawyers, radio presenters, have been masters of the universe, masters of their own life, in control of their own life. And no one can see the illness, so no one actually often believes them that there's something going on. So they take time off work, and their employers are terribly supportive for the first few weeks or months. And then their employers lose faith, and then they lose their jobs, and then they lose their self-esteem and their self-worth, and then they decondition further. That's what chronic balance does to people, and it destroys people's lives.